Hello, good afternoon, everybody. Yes, it's really good to be here. I want to talk today about our little unit in Parkes in Central West New South Wales. Just to give you a bit of a background, for those of you who are unfamiliar with the area, Parkes is located in Central West New South Wales and is approximately 5 hours drive west of Sydney. The area is mainly made up of farming country, but there is also a large gold mine situated just out of town. There's a population of about 10,000 people. We do have McDonald's and KFC, but we don't have a traffic light. No traffic lights. A few of you may recognise this. This is the dish. Parkes was made famous by the dish. This is a large radio telescope which was used to track the moon landing in 1969. And more recently, by this. The hugely popular annual Elvis Festival, which attracts tourists to the town from all over Australia. And I've just had a lovely holiday over in Western Australia, and whenever anybody asked me whereabouts I was from, every single person knew of Parkes and the Elvis Festival, so it's certainly reaching far and wide. Unfortunately, it's always held in January, and you can imagine in those costumes, in Parkes, it's often 42 degrees when they're doing that parade. Okay, so the map. If you look at the centre of the can you see where Dubbo is and look down to Orange? Orange is our major centre. That's where our Orange Cancer Services, where we're administered from. And Parkes is just off to the right, sort of basically in the centre of New South Wales. We're located in Parkes at the Parkes Hospital, but our patients can travel for over 100 kilometres to come to us for treatment. If you have a look at the surrounding towns, we've had patients from as far as Lake Jellicoe, which is 2 hours west, so 200 kilometres. And routinely we have patients from Condobolin, Forbes, Peak Hill and the smaller communities in between. So our clinic is a satellite service of Orange Cancer Services at Orange Base Hospital. That's 120 kilometres east of Parkes. Now, unfortunately, my colleague Rachel was supposed to be with me here today, but she dislocated her knee at basketball last night. So we live in Forbes and we travel to the clinic. And this is Forbes. Beautiful Forbes, having a flood at the moment. The oncology service has been operating in Parkes since 2010 and was initially run and staffed by a nurse driving out from Orange Base Hospital once a week to administer chemotherapy. We started in a small room with 2 treatment chairs. She used to bring the drugs with her in an esky in the car boot. Myself and another local nurse worked alongside on alternate weeks, completing the graduate certificate and gaining invaluable knowledge and experience from the Orange nurses. After a few years of training, we were able to operate without the Orange staff, which was a very nervous transition period. And since then, our service has progressed to be located in the new Parkes Hospital, which opened in November last year. We now operate on 2 days per week, treating up to 10 patients per day with 2 registered nurses to staff the unit. Our room has 6 chairs, though we are currently funded for 4, and the other 2 are to plan for the future. We remain a satellite service of the Orange Cancer Services and remain very well supported by them. This is the new hospital. We do all of our own appointment bookings and we're careful to space time so that for the most part, patients are not sitting waiting to come in. We have worked hard to create a welcoming environment to make the patient and their family feel as at ease as possible. No one likes to be kept waiting. If we're prepared and ready when they arrive, it is one less stress for them. And I think picking up from the conference this morning, the talks this morning, it's really important to get the little things right. And I think if we can just do the little things that make people feel safe, secure, confident, then they're more likely to open up and discuss some bigger issues with us. So the unit's staffed by myself and one other RN. We're responsible for all our own ordering of supplies, patient refreshments, and ensuring the medications are ordered each week. The drugs are delivered by courier from Sydney once per week. We don't have an on-site oncologist or haematologist. We don't always have a medical officer in the hospital. It's a 28-bed hospital. As such, we rely heavily on communicating using phone and email. Over the last 18 months, we have welcomed the introduction of the Mosaic Oncology online medical record system, and this has made a huge improvement for us in communication. It allows us to instantly access all notes and treatment information for each patient of the service, so we can see what's been going on with them in Orange, what's happening with their treating specialist, and so that we can be aware of any circumstances surrounding their care. It helps that we have a very rigid set of guidelines to adhere to. We must assess each patient's fitness for treatment at each visit, ensure they have been reviewed by their specialist, check pathology results are within treatable limits. We don't have on-site pathology at the hospital. If we need to test anyone's blood, it needs to be sent by courier to Forbes, which is 32 kilometres away. So all those sorts of things, a bit different out in the country. So we need to look at their side effects and adverse effects of treatment, both physical and psychological. If we have any concerns at all, we seek advice from either the patient's treating specialist or from nursing colleagues in Orange before proceeding with treatment. Another huge advance in technology which has made such a difference to treatment in our area is the use of telehealth. Using the hospital video conferencing system, patients can have a consultation with their oncologist. Currently we don't have that offered to haematology patients, but I think that's going to happen. I hope it will. Telehealth means they're able to stay close to home, avoiding the stress of long car trips, and they're able to converse in real time with the doctor. It's available in even the smallest of our communities, in MPSs and in doctor's surgery, in some places where they don't have an MPS. The images are crisp and clear. There's no time lag in speech like Skype. Doctors are able to have a very clear impression on how their patients are managing treatment. To support each patient, one of our community nurses will always sit in with each consultation, and that's to give information to the doctor and to also explain things to the patient if they need any further clarification. This is one of our patients, Clary. On arrival to our unit, each patient is met by the friendly face of our CanAssist volunteer, Pat Bailey. Pat attends the clinic every day and has done so since we started up. She is on hand to greet each person. When they are settled in a chair, she offers a drink and a snack. This is a great help to us when we're busy, but it also gives another dimension to our service. The local CanAssist groups of Parkes, Forbes and Condobolin do fantastic work to support cancer patients and their families. All money raised is spent locally, and they are very well supported by the community with donations. In practical terms, they can help with the costs of medication, transport and accommodation associated with treatment, but emotionally they are there to give care and support, given from people who have experienced similar issues and circumstances themselves. Clary comes from Condobolin, and he's been coming to us for about 5 years. This is Bernadette in the orange cardigan, our palliative care nurse. We're very fortunate to have a great support network of members of the allied health team for our patients. And how it was mentioned this morning about the staff loitering, we do have a lot of chocolates in our room. So we do attract some loiterers, but that's fantastic because I'm sure a lot of you would realise that a referral to a palliative care nurse can be very, very confronting. People think, well, that's it, now palliative, that's the end of that. But if they're loitering, if they're there saying hello, having a chocolate, having a laugh and a chat, they're more familiar, and it's not going to be such a transition for when we say, look, would you like to have a chat with Bernadette? So she'll come in and have talk, giving invaluable advice on management of symptoms associated with illness and treatment, great source of psychological support, terrific referral networks onto palliative care specialists, and also to act as a bit of a go-between with the patient and their doctor to enhance their care. One of the drawbacks of being in the unit is the confidentiality, so there really isn't much confidentiality. A curtain's not going to protect anything like that. So we're very mindful of confidentiality, and if we think there's something that's more sensitive, we'll direct that outside of the clinic. This is our breast care nurse, Diane. She's a wonderful support person to assist our ladies with breast cancer. She's usually available to sit in on telehealth consults, so it's that continuity, that friendly face, that person with the knowledge and experience to give you some practical advice. She'll pop in and have a chat, have a chocolate. She's available by phone. She's started a weekly exercise group to promote physical and mental well-being. As well as that, she's very active in promoting the detection and management of lymphedema and is a very good referral with those sorts of things. We've also recently been lucky to have a prostate cancer nurse appointed in Orange who networks out our area to give the men some well-needed support as well. And I think it would be great if in the future we could have more specialist nurses to assist the patients in our area to give that tailored support. We've also recently started a program in conjunction with the physiotherapy department, acting on the research showing a link between better outcomes in chemotherapy combined with exercise. So following treatment, we encourage the patients to walk down the hall to physiotherapy and have a ride on the exercise bike, which is also a very friendly little room. One of our patients with myeloma told us that she'd had the best afternoon after chemo that she could remember after having used the exercise bike following treatment. You may have noticed in the slides that our new hospital has very bare, bright white walls. The hospital has been working with community group Arts Out West to display artwork in the corridors of the hospital, but we were told, well, we couldn't really have any in the unit because of infection control. So we weren't really that happy with that. So after lots of discussion, they came up with a solution of providing artwork they've asked for contributions of photos that reflect loved landscapes. So beautiful pictures of beaches, rainforests, places to dream about. So these photos will be enlarged onto decals that will be mounted onto the walls above each treatment chair to give life and colour to the room and to provide something for the patients to enjoy and talk about during treatment. Our unit is very friendly. We strive to treat each person as an individual and cater to their needs as much as possible. I suppose the message that I wanted to get across to you today is that just because we're located in a rural area, we don't have all the doctors and specialists located in our hospital, we are very, very lucky to be able to have very good networks with the support people that are available to us and to be able to refer our patients to those people when necessary. Patients have remarked to us that they feel comfortable in the unit and are able to talk to each other, something that they don't always find in the larger settings. And just like it takes a village to raise a child, I believe it takes a community to support someone with cancer. I think we're doing this well by treating each person individually and connecting them to support services to be able to help them. Of course, there is always room for improvement, and we enjoy coming to gatherings such as this to get ideas from you all, and I've got some fantastic ideas today and hoping to take them back to benefit our patients. Thank you.
Thank you very much, Karen. Is there any questions?
That was brilliant. I'm just wondering about access devices. If you have trouble, and you need someone with a port or a pick, do you have to go to Orange for that, or what actually happens?
So if we have trouble...
If you have trouble and you need to have a port put in or a pick line put in,
yep.
do you have to go to Orange or whatever? So that would actually be the place of choice for it.
But because we're a satellite service and we have no on-site oncologist, we never do the first treatment in Parks because we don't like that sort of excitement. So we'd rather they always have their first treatment in Orange, so they've got that red bell that they can press if they get all the help. And then when the oncologist, usually at least after the first, but maybe after the second treatment, they'll come up to us, they'll already have their port.
Okay,
we have doctors that can put picks in but not ports locally at the moment. They can take them out but not put them in at the moment.
That's good.
But no, the Orange is fantastic, very quick service. Yes.
Karen, still on that clinical aspect,
Yep.
for you then drawing from general practitioners in the community, is that who supports if you did need immediate medical support?
So if we did have a situation, we've got the emergency department on site and they always have a doctor on call. They may not always be in the hospital, but they're always on call. And in the rural area, we have flex trained nurses, first line emergency care, so they can initiate treatments before the arrival of a doctor. And we do have one nurse practitioner now in the emergency department as well, which is really helpful.
Yeah. Thank you.
Karen, I've got one. The quality of cancer service delivery in New South Wales has been under the spotlight recently, as everyone's very well aware.
In the paper today, actually.
Yeah, yes, and probably in the paper tomorrow, and for a few more to come. But I think it's fantastic that you're able to demonstrate that small regional centres can still provide high quality services. And I work in not as small, but certainly our regional centre does have issues as well. The issue of staffing and continuity, I guess, is always a challenge for me as a manager. We're always staffed as just enough. We've got one of everybody. What's the continuity plan if the flu goes through the place or Tass Lotto numbers come up and everyone's...
snap attendant.
Yes.
Yes. I just had 6 weeks off, and the day before my holidays finished, I snapped attendant. So I'm allowed to supervise, but I can't do hands-on work at the moment. So unfortunately I'm the only person with the graduate certificate, so I need to be there, and the other nurses can work under my direction.
And is there any succession planning to train up staff at that hospital, or is it a matter of closing the doors and sending everybody
No,
down
they've
to
tried to, and there's funding to have that grad cert fully paid for, but it's a huge commitment, and so unfortunately at the moment we haven't been able to attract anybody that is doing that. So yeah, we would love some more nurses. So if anybody's interested in is it a tree change?
Yeah.
It's a beautiful area.
Bit of an aqua change at the moment, isn't it?
It is an aqua change.